I'm finally at a place where I can speak out and really talk about how hard this last year has been. And I think it's really important for everybody to understand, because this is what providers are going through, trying to provide care that we've spent years educating ourselves and becoming the best providers and the best treatments. And that doesn't even matter anymore. When you go to a provider and you share your story, you share your fears, your concerns, and you work together to come up with a diagnosis and a plan, that doesn't even matter. The insurance companies are in control. They are the ones that say, this is what's going to happen, and this is how much care you get. And it's just so broken at this point, and somebody has to hold these companies accountable. It is not the way the system can be. One of the biggest insurance companies in New Hampshire has really put us in this program, micromanaged everything. I mean, they paralyzed our business. They came after us for really no apparent reason. And even the small clerical errors that they found, it's like such small things that could have been rectified with good communication. They couldn't even follow through with their program. But no one's holding them accountable. Nope, it's just them telling themselves what they can or can't do. They take money when they want it. They deny when they want to. And it's just really not sustainable. And I just see us on this really, really bad trajectory. So I'm saying this to really just, kind of know what we've gone through and how hard it is for providers. It's why you're getting more notices that says your providers cannot take this insurance. I mean, all of them are doing it. They are coming after small providers. They are coming after the people they know they can't fight. I mean, iLawyer said that we have a great claim, but the amount of money it would cost me to start that, I just don't have. And the fact is, we've already lost one clinic. People have lost their jobs. Patients have lost care. It's just, they're not in healthcare. They are a business, and it's a money-making business, and that's it. I think as people, we need to fight back. And I say this because I didn't even know this was an avenue, but we have to complain. We have to complain. And the New Hampshire has an insurance commissioner, and there is a website that you can file a complaint. And I suggest that you file a complaint every time your care is limited, every time it's cut off, every time it's different than what your provider recommended. Complain. They're not going to believe that there are issues until the documentation is there. And I really hope that potentially, since we are a small state, we can maybe make some ground and cover some ground and try to make some changes. There's some great changes happening in some other states. And we really have to limit what insurance companies can do. I really do feel like they are practicing without a license. I mean, how can you read a documentation and you say yes or no? I mean, you didn't even meet the patient. You should not be allowed to dictate care when you have not been the one personally involved with that patient. End of story. So for me, it's been a struggle. I mean, we're still here. Oceanside is not. I'm not going to take 20 years of expertise and minimize our care for what the insurance companies deem valuable, which isn't very much. They're a money-making organization. They're a for-profit organization. That's what they're going to do. And care costs money. So that's not hard math. It's just really unfortunate. I mean, I've dedicated really my whole career to this service, and initially women and pelvic health, and it was something that was niche, and I was glad to provide it. I'm glad there are more providers out there, but it's really hard to survive. The limitations they put on us as provider, especially pelvic providers, it's just not sustainable. And, when you get those letters, try not to be mad at your providers, because we're just trying to survive. And it's why all these small providers are being eaten up by the hospital. They get some more money, but they're being challenged as well. It's just not a good system. So we are still here. We provide a lot of different alternatives. We've come up with some creative solutions. The silver lining is nobody's telling us what to do, right? We can do whatever you want, whatever you need. I mean, the insurance companies really tell you everything that you can do. And they're just limiting it further and further. So we're not limited. We do still accept some insurances that haven't put a huge administrative burden on us, but I wouldn't be surprised if it's coming. So I say this because I want you all to advocate for yourself. Get an HSA, get an FSA, put some money away. The only thing that's going to matter is freedom of with your money. That's the only thing that's going to talk. Insurance companies are really just catastrophic plans at this point. They take so much money, and all they hope that you don't go. So reach out with any questions. I'm happy to help advocate for you all. I hope that you find all of your healthcare needs, and I would just say, just keep going, keep searching, and you really have to advocate for yourself and put together a healthcare team that works for you. And I guess that's the benefit of doing it yourself. And I know not everybody has access to that, and that's the unfortunate aspect of it. But if you prioritize it, it'll at least be accessible a little bit more than if you expect the insurance company to be there for you, because that is sure as heck not what they're there for. Thanks so much.